Hi, I'm Dr. Amanda with Tiger Family Chiropractic and Wellness Center, and I wanted to take a moment because I've had multiple patients recently ask me questions about having extra curve in the top of their back. Some people have referred to it as a Dowagers hump. Others refer to it as a kyphosis or hyperkyphosis. Either way, I wanted to just kind of dissect out two different types of changes that we see in that area. So the Dowagers hump, which is what a lot of people are most familiar with, actually does include what they would call like a fat pad of tissue on that area, versus a kyphosis or some extra curvature through there is often very nodular and bony feeling. And so the first thing you might do is just take a moment, if this is a concern for you, and really press into that upper back area and see if you feel like some cushioning before you reach a bone. If you do, there is some adipose or fat tissue there. If it's just hard and nodular, then we're probably looking at the situation of some breakdown of the tissues relating to the spine. So the discs and those areas surrounding. So either way, why do we get that, right? Like what happened? And there is some consideration with regard to it being hereditary. I can't particularly comment on the, likelihood of that applying to each individual person. I think there's definitely a possibility that if nothing else, we have learned behaviors and patterns from our family members that impact things even into our body makeup and how we stand and how we move. And so another thought has to do with, especially if it is the adipose or fat tissue in there, is it for protection? Is it a combination of a process where your body has some degeneration through here, has some inflammation, some irritation, and then develops that tissue surrounding it in order to add protection? Most likely, the two things I think apply to it, though, are relating to posture specifically and relating to excess fat storage in our bodies. And so specifically posture for sure. What we keep in mind, and I can use the example of scoliosis possibly easier while I'm seated. If you had a curve in your back, if we were facing one another, first of all, your spine should be straight. And so if I had a curve in my lower back that was like pushing me off to the side, my whole body wouldn't just lean over and fall, right? What happens is the mid back curves the other way. And then I don't lean like this either. I have what's called the writing reflex. My eyes want to see the horizon. And so my head kicks back over the other way. And so suddenly I have these compensations in play in order to keep my eyes on the horizon. Well, similarly, when you are engaged in a seated posture, we're there a lot lately, right? Your shoulders may droop forward. And your head may move forward, but your body can't keep falling forward. It has to have something to compensate and pull back the other direction. And so to some degree, that extra kyphosis seems to be this like way that your body's making counterweight for the head, when your head is so far forward. And we measure specifically where the earlobe is in relationship to the shoulder. The further forward the head naturally hangs out, in front of that shoulder area, the more complicated and more likely this situation is to become. And so I think as far as addressing the Dowagers hump or a kyphosis or whatever appropriate situation you have, I think goes back to number one, addressing posture. I think that's an absolute, and there's a lot of strategies to have better posture, and I'm happy to connect our patients with those strategies. Another thing is, if it is adipose tissue, if it is some fat tissue in there, there has to be some fat loss. And, as far as our bodies go, I wish upon wish that we could just pick, when you lose weight and you want it to be in a certain area, but your body has this other plan and it just like takes care of it somewhere else first. I'm always like, man, can't I just direct you and tell you where to do this for me? No, it hasn't worked out. And this may be a similar situation where this is something that you're pursuing for a number of months, weeks, or years in order to establish that change in your body where your body decides that that's the area to make a change. And so all those details I hope are helpful as far as, surgical changes, as far as things outside in a more traditional medical model. I couldn't speak to those. I've seen that they exist, but I just don't have any professional reflection on those. But of course, if you have more questions, more specific concerns, I would be delighted to spend time with you and kind of dissect that out as one of the patients for our office. So thank you. Take care.